Now we're going to take a look at major minerals. Keep in mind that the minerals classification is broken down into a couple of different areas. We have major minerals and then we have trace minerals. We also have something called ultra trace minerals, which I'm not really going to talk too much about. When we speak about minerals, keep in mind that these are naturally occurring and that they're inorganic. So if you remember back to high school chemistry, if you took it, or even just seeing the periodic chart, you'll see all of the different little squares and they talk about silicon and nickel and all of these other elements. That's what we're talking about here. They're chemical elements and they're going to be integrated into all of the foods we eat, especially things that have grazed on the soil, so it could be livestock and anything grown in dirt basically. As I mentioned, there are major minerals, and these are found in the body in certain amounts, and that's what makes them a major mineral. It's not necessarily the amount we need from the diet. So when we look at the major minerals, these are found in the body in amounts more than 5 grams. So that might give you some ideas about where we're going to find them in large body structures. Then we have trace minerals, and these are found in smaller amounts, less than 5 grams in the body. And that's really the distinction between these two groupings. And then, as I mentioned, the ultra trace minerals, and these are found in infinitesimal amounts in your body. And we don't encourage people to seek these out in any way because your diet is naturally going to contain enough of them. So let's talk about some of the major minerals. First one I want to mention is calcium, and this is the one that is most abundant in the human body. And that might make sense if you think about the way we're put together. You know, we have this really incredible skeletal system, and that is a really big reservoir of calcium. If you look at the food sources, we're probably most familiar with dairy products as being a good source of calcium, so we have that up there. We have a glass of milk. We also have a lot of other sources, so even for someone who doesn't choose to eat dairy products, they should not have a problem with calcium. And we want to get people around the idea of using green leafy vegetables or green vegetables in general for some of their calcium requirement. Additionally, I want to talk about some of the roles with calcium. So as I mentioned, it is the most abundant mineral in the body, and you're going to find most of this in the bones and teeth, although you will find some of it intercellularly and in serum. It's an important electrolyte. It's really essential for contraction of muscle and then also heartbeat. So you see it playing this role as an electrolyte to help maintain that heartbeat. It also is involved in hormones and digestive enzymes and neurotransmitters and all of these smaller roles in regulation. It's also an enzymatic component. I want to spend a little bit of time, now that we kind of have a basic about calcium, and I'm going to run through some of those basics pretty quickly on these major minerals so that I can talk about some of the pathology we see when people don't have enough of any of these major minerals. So in order to talk about that with calcium, I just want to say kind of our status with calcium in the U.S., and we aren't doing very well, to be honest with you. Women achieve about 1/3 of the RDA, and men are doing a little bit better. They get about 3/4. So there's a lot of room for improvement here. When we talk about deficiency, we're going to see a lot of the same kinds of problems we saw with vitamin D deficiency. Keep in mind that these should be very, very well linked in your mind because they have this integral role together. So when we don't have enough, we see a lot of problems with skeletal health, which should make sense for you. Bone loss, especially in adults as people age, you're going to see this. You can see high blood pressure when people don't have enough, and then also sometimes the formation of kidney stones. That's something that we also see as a problem. As I mentioned, really milk and dairy products is probably the #1 source in the U.S. And when you think about the shifts that have happened in our food supply and then also the foods we're choosing, especially with young children, they're choosing more fruit juice and more soda and even drinking more water. So overall, milk consumption has declined. And we see a corresponding decrease in bone health for a lot of folks. Now, when I talk about that dairy group, even people who don't choose to drink milk can still use a lot of those dairy products that are calcium rich. Things like yogurt, that's an excellent source, and some cheeses, especially if the problem is lactose intolerance, because the bacteria in the yogurt actually ferment that lactose, so most of it is about 99% lactose free. I also said that dark green vegetables are a good source. There are a few exceptions to that, so take note of this if these are some foods you're eating. Spinach and Swiss chard and also rhubarb, and of course we're eating the stalks of the rhubarb, never the leaves. They're poisonous. But what happens is that there's a competitive binding here, and those particular greens contain chemicals that are going to bind the calcium so that it passes through the body unabsorbed. So we want to be a little bit careful if people are trying to meet their calcium needs from these particular greens. Other things are a great source, so if someone is choosing something like kale, really high in calcium, good choice. Also broccoli, not a leafy green, but still a very good source of calcium. I told you that bone loss was a particular concern with calcium, and so I just wanted to talk to you a little bit about some of the issues that we're seeing with adult bone loss. We call it osteoporosis. You might also see it referred to as osteopenia, which is considered kind of a similar issue. And when we look at what happens in terms of people's skeleton, you can see here we have a 50-year-old woman, and then we have someone who's 80. And there's a real decrease in her stature over time. Because there isn't enough calcium in those bones, you tend to get compression and microfractures and this compaction. So people lose height. And we want to avoid that if we can. Now, we have a picture of a woman here because really this is a disease that affects women disproportionately to men. And one of the big reasons for that is menopause and the lack of estrogen. As women age without that estrogen, we see particular bone loss. It's very precipitous. And so we really want women to start out their early years with sufficient calcium. There are some other risk factors to consider that are not things we can really change. So gender, advanced age, genetics plays a role. So if your grandmother has had osteoporosis, it's a little hint to you to be really careful about your calcium and vitamin D intake. Also environmental factors. And when I talk about environmental factors, I actually kind of spelled out a nice list here. We put poor nutrition under an environmental factor. And really what we're talking about here is poor calcium and vitamin D intake. But when we look at just overall quality of diet, we want somebody consuming a very well-rounded, adequate diet and all of the other micronutrients. I mentioned estrogen. Lack of physical activity also plays a role. Being underweight. So this is an area where higher BMI is protective against osteoporosis. People that tend to overindulge in alcohol or use tobacco products have lower bone mineral density. And there are quite a few studies pointing to these other sources. So excess protein, sodium, caffeine intake, and soft drinks with a lot of phosphorus, that's the agent there, as being implicated in osteoporotic development. And then in inadequate vitamin K intake. We'll talk a little bit about the relationship there, but take a look back at the role that vitamin K plays. It has to do with blood clotting, and it's also involved in bone health. Now we want to shift gears away from calcium and talk about phosphorus. And this is one that is well supplied in the diet. It's very widespread. There are plenty of good food sources to this. So we can see cottage cheese, for instance, dairy products, meats. Really a lot of high protein foods are rich in phosphorus. So this isn't one I have to ask people to seek out in any way. It's implicated in bone health, just like calcium. So calcium and phosphorus are going to both be critical minerals for bones. This is the second most abundant major mineral in the body. And again, we're going to see that this is found in bones and teeth. It has a couple of particular roles in acid-base balance. That phosphorus acts as a buffer. It's also part of DNA and RNA, so those genetic proteins. It's going to also be involved in some metabolic processes. So when we look at that conversion from food into energy, that's where phosphorus is going to play this important role. It's also involved in lots and lots of different enzymatic activities. Generally, we call these phosphorylation activities, where phosphate groups are added or taken away. And this is even how we store glucose. So if you think back to our glycogen conversation, in order to keep that glucose in the cell, we add a phosphate group to it, which anchors it, and then we can build that glycogen from there. So that's another role for it. And then we see it's part of the phospholipid kind of complex. So we talked about phospholipids being two fatty acids and then that carbohydrate or glycerol backbone and the phosphate group. So it allows that particular type of fat to complex with water, if you kind of recall that conversation. It's also present in some proteins. So that's really it for phosphorus. I want to move on to magnesium and talk about this one a little bit. Magnesium, again, widespread in the diet. So you would think that probably Americans don't have too much trouble with this, but we have a little bit of trouble. And I'll kind of talk about why that is. But this should not be a problem for someone on a particular diet plan. If they're vegan or if they're lactose-free or gluten-free or any of these dietary traditions, magnesium should not be an issue. Leafy greens tend to be very high in magnesium, so that's always a good choice. And even legumes. So again, it should be pretty widespread in the diet. This particular mineral also, just like phosphorus and calcium, has a lot of different roles to play in the body. It's really active in enzymatic reactions and releasing energy from food. It's also going to be important in the kind of metabolism and use of different kinds of vitamins, and also calcium, which is one of the minerals. It acts in soft tissues in the cells there. You need it for the functioning of muscles, and it's also going to help you prevent tooth decay. We often just think of fluoride as doing that, but here we have magnesium playing a role in that as well. Now, the needs of magnesium are really very easily met by most diet. So deficiency or frank deficiency is really unknown, or generally unknown, especially in Western societies. But instead what we see is low intake sometimes. So we have to be a little bit concerned with that. Now, we can have some reasons why people might be low or somewhat deficient in magnesium, and they tend to have to do with illness. So if someone is experiencing prolonged vomiting or diarrhea, or even if they just have very, very low intake. Alcoholism, protein malnutrition. Again, the protein malnutrition is pretty rare in the US. Alcoholism, unfortunately, is a little bit more common. And then the use of diuretics. So these are some medications to help remove excess body fluids, especially for someone who's maybe dealing with congestive heart failure. That might be a drug that they're on. Some of the deficiency symptoms we see are a little bit surprising. Hallucinations. Now, if you went to your doctor and said you had hallucinations, the doc is not going to say, I think it's a magnesium problem. So this, again, is where we really want patients and consumers to be very, very aware of their diet. Now, this is quite rare, again, I want to say, especially in normal, healthy people. But what we do see is that about 75% of Americans are not meeting their recommended intake. There are reasons why this happens. One of them is that magnesium is easily lost during food processing. It could be as simple as washing and peeling, like carrots or potatoes or something like that. Or if people are eating a diet that's really high in processed foods, they're going to see that they're not getting the magnesium that naturally would be in those foods if they were less processed. Generally speaking, we don't lose minerals through processing. It's vitamins that we're concerned about. This is kind of an exception to that rule. Now, with toxicity, this is only going to be a really significant issue if people are taking supplements. Sometimes certain medications, magnesium salts might be something that somebody's taking for some reason. Accidental poisonings also. And some of the toxicity symptoms that we see, again, a lot of the ones that are similar to deficiency. You can have problems with GI distress, vomiting and diarrhea, also acid-base balance, and dehydration. And magnesium is an electrolyte, so that's part of the puzzle there around dehydration. Let's talk a little about sodium. Now, sodium is a little bit of a, I'm grappling for the right word here. This is a cautionary mineral. We have to be kind of concerned with our sodium intake. And if you look at our food supply, it is just so rich with sodium. We see table salt. We also see all kinds of processed foods being very high in sodium. And it's very, very hard for people on a low sodium diet to actually avoid it. Most of the places where people are getting their sodium tend to be these processed foods. Although if you look at things like celery or cauliflower or cabbage or any of those vegetables that are grown very intimately in the soil, you're going to see that they all contain sodium. It's just part of the natural part of this process of absorbing nutrients from the soil. Now, when we look at the different kinds of functions, this is one of the really critical positive ions in the body. So it has a really big role to play as an electrolyte. It's also involved in all of these other areas. So fluid balance. So if you think about if you have a little extra sodium on board, you might be retaining water. So again, this is a concern for people with congestive heart failure or other kinds of conditions. It's important in extracellular fluid balance, acid-base balance, muscle contraction, nerve transmission. And this is one that you really want to make sure that you have enough of. And luckily, our body regulates this without us even having to think about it. If anything, I really have to get people away from sodium. Deficiency is really unknown. No diet lacks sodium. So that's kind of the good news in some ways. And the body absorbs it very easily. The kidneys are really efficient for the most part in a healthy individual at making sure that the sodium balance stays exactly where it should. So in times when there might not be enough sodium or someone's on a very low sodium diet, the kidneys will conserve that. We do lose some sodium through sweat. And this will sound a little gross, but some people tend to excrete more sodium during exercise or during periods of heavy sweating than other folks. And so if you're curious, if you're somebody who tends to lose more electrolytes, just lick your arm and you'll know. And you can even just feel it. Like in the summer, if you're out running or biking or something like that, you can feel that grit, that sodium on your skin. And that'll kind of give you a little bit of a hint sometimes if it's something you actually need to stop and have a snack. For most folks, it's not a problem. Now, I told you that we need to limit sodium. And one of the ways that we can do this is actually fairly painless, luckily. We can use something called the DASH diet. And that stands for Dietary Approaches to Stopping Hypertension. And the idea here is that we want people to make specific choices, not just about the amount of sodium in their diet, but also about the foods they're choosing. So I want to talk to you about what this diet looks like. It's very, very similar to a Mediterranean diet, which has a strong reliance on fruits and vegetables, and uses a little bit of nuts and fish and whole grains, and not too much dairy, and the dairy that is there tends to be lower fat. And we really want people to kind of use very sparingly red meats, butter, and other high-fat foods and sweets. So it's not just about the sodium, it's about an overall healthy diet. The good news here is that this is delicious. I mean, all of these whole foods are absolutely tasty, but it tends to be a little bit expensive for people. There are ways to make it much more reasonable. It also involves a little more preparation and cooking. But what we found here is that the importance of this diet really rests in the amount of potassium in it. Now, potassium, we haven't talked about this one yet. It's found in fresh fruits and vegetables. Most people say, oh, bananas are rich in potassium, and they are. But there are many, many other sources in the diet, especially things like potatoes, believe it or not, are rich in potassium. The way this works is that potassium and sodium are antagonists, which means that they're going to counteract the mechanism of each one. So if you can balance these two, you tend to be able to control hypertension or high blood pressure a little bit more. So it's, with the sodium reduction, you might get this level of response with controlling the hypertension. With having more potassium, you're going to reach up just a little bit further than you would have just based on sodium restriction. And I should also mention that not every single individual is salt sensitive. So people that have high blood pressure are often, the blanket recommendation is avoid sodium. But we also want to tell them, make sure that you're getting more potassium in your diet, because that's going to play that critical role as well. Now, we want to talk about potassium now that we've kind of introduced that idea. Move on from sodium. So we mentioned bananas are a good source and potatoes, but also lima beans, which are probably one of your favorites, right? You can also find it in other kinds of fruits and vegetables as well. People should not have a potassium problem, and yet we do, because we don't consume enough of these particular food groups. The average American gets about maybe 1.25 servings of fruits a day. And vegetables, we're not doing much better. It's about 1 serving. We really need to get more traction in that particular area. Now this again is another one of those charged ions. It has an important role to play in fluid balance, electrolytes, maintaining all those cellular functions, and especially in heartbeat. When we do see deficiency, there are particular reasons why it might happen, and sometimes the result is sudden death. And this is, and I want to underline this, very, very rare. It might happen for someone that maybe has been in a starvation situation and we're refeeding them. So it's associated with refeeding syndrome very often. And we're very, very good at doing this now. So it's not such a threat. But your book talks about it a little, so I just wanted to mention it. A couple of things that we do see with potassium in terms of low intake. especially related to high blood pressure, is that we see that people who already have established hypertension or even undiagnosed hypertension, which is quite common, low potassium tends to increase that blood pressure. So it's going to worsen that. You can also see some smaller issues that are surface with deficiency, especially around glucose impairment. But again, these are much lower level. Really what I want to focus on is that relationship with sodium in hypertension. Now we can have too much potassium, and it's not going to happen from foods. You could have 10 bananas a day. You're not going to poison yourself with potassium. You might have some GI trouble, but it's not going to be a potassium problem. One of the ways that we see some toxicity surfacing is with lethal injection. And again, this isn't something that's very common, but it's just kind of interesting and helps us to understand how this functions. When there's a huge blast of potassium, what can happen is that it fills up all the channels, all of those ion channels in the heart, and you're not able to actually maintain heart rhythm. And we're using specific types of potassium there, so potassium chloride. We don't want to take any over-the-counter potassium supplements or salt replacers that contain potassium without specific doctor's advice. And a lot of these are marketed without any warning, so be very, very careful with those kinds of things. Let's move on and talk about chloride a little bit. This is another one of those important ions, and if you think about where you might find chloride, maybe you're familiar with NaCl. So that's just what we call table salt. That's the chemical formula. So we're finding this in table salt and in any processed foods that contain sodium. So again, there should be no reason why any diet is lacking in chloride. And I should also mention that chloride is different than chlorine. Okay, so it's a different form. Okay, this is chloride that we find just naturally occurring in foods, and, as I said, in table salt. Chloride's role is in acid-base balance, electrolyte balance. Okay, also this is one of those important electrolytes, and it's a component of hydrochloric acid, which is found in our stomach. I mentioned that the main source is going to be salt, and in terms of deficiency, we're not going to see deficiency. It's just not really a problem. I'll talk a little bit about sulfate as well. This one, again, is one that is ubiquitous in the diet. It's required for several different functions with antioxidants, with thiamine metabolism. Thiamine is one of those vitamins that we've talked about. And also in the production of sulfur-containing amino acids, because sulfur and sulfate, you should link those up in your mind. Deficiencies here are relatively unknown. You would only really see it in someone that's starving and has an absolutely protein-free diet. And even then, I'm not sure that you would see it. There's not too much in the literature about sulfate deficiency. We can see toxicity, though, especially from water contamination. Sometimes people's wells will have a lot of sulfur, and you can smell that. It smells a little bit like eggs. And so we encourage people to test well water if they're using a home water source. And that can result in some folks having diarrhea and even colon damage and lower GI tract issues. Sulfate, again, it's found in any protein-rich food, so that shouldn't be a problem for most people in the diet. So those are our major minerals, and then we'll move on and talk about the trace minerals.